Open Day on Women, Peace and Security. Apologies for starting a bit late. We had some difficulties, but everything is solved right now. So Global Open Days were launched in 2010 in commemoration of the 10th anniversary of the United Nations Security Council Resolution 1325 on women, peace and security. They are meant to provide a platform for women and girls to raise their voices, concerns, and needs on matters that affect their lives. Today, we will be discussing about the disproportionate impact of COVID on women and girls and the importance of including them in all pandemic-related decision-making. Two housekeeping issues. You can listen to this event in English, Albanian, and Serbian. If you go to the down on your screen, you will have an icon of a little planet, and then you have the options. And second, if you wish to make any comments or questions, please feel free to do so anytime in the chat. We will do the best to address them. We have a very interesting panel, and we will also have a live illustrator connecting with us from New York, who will be visually recording this meeting. So we will be presenting her illustrations in the end of the meeting. Without further ado, please let me welcome the Special Representative of the Secretary General and Head of UNMIC, Mr. Sahir Tanin, to provide his welcoming remarks. The floor is yours, SRSG.
And start again.
Sorry about that. The technical problems is affecting everybody. I said thank you very much, Javiera, for your introduction. Distinguished guests, participants, and friends. It's my pleasure to welcome you to the 10th Global Open Day on Women, Peace and Security in Kosovo. The last time we came together to celebrate this event was over a year and a half ago. Much has changed since. The sudden, unprecedented, and multidimensional impact of the pandemic has affected all of us in a myriad of ways, in too many instances, unfortunately, tragically. Women have been the most affected. The pandemic has progressively intensified pre-existing interconnected systemic and existential risks, resulting in considerable setbacks to our joint pursuit for gender equality and the empowerment of women. These risks include extreme poverty, food insecurity, economic meltdowns, domestic violence, loss of income as a result of increased unpaid care work, and reduced access to education and health, including sexual and reproductive health, among others. As stated by the Secretary General, COVID-19 is a crisis with a woman's face. Women around the world and here in Kosovo have been at the forefront of the pandemic's response as frontline workers and primary caregivers. But they have also faced the challenges I have just mentioned. And yet, despite being at the center of response and recovery efforts and enduring the toughest consequences of the pandemic, women have been mainly excluded from pandemic-related decision-making. We, the United Nations family in Kosovo, have placed women's need in priorities at the center of our efforts to support the COVID-19 response and recovery. We consider this priority not only because it's a moral imperative, but because we will not be able to recover if we don't tap into women's talents and potential in equal measure with those of men. Dear friends, at the onset of the pandemic, the famous Indian author Arundhati Roy called for a renewal of thinking in the light of how pandemics, I quote, forced humans to break with the past and imagine their world anew. This one is no different. This pandemic is no different. It is a portal, a gateway between one world and the next. We can choose to walk through it, dragging in the carcasses of our prejudice and hatred, our avarice, our data banks, our dead ideas, our dead rivers, and smoky skies behind us. She continues to say, or we walk through lightly with the little luggage, ready to imagine another world and ready to fight for it. End of quote. The pandemic has posed innumerable challenges, but we must also see it as an opportunity to commit to building more inclusive societies in which everyone has a voice. To quote the Secretary General in his speech last week, marking his appointment to a second term, the pandemic has revealed our shared vulnerability, our interconnectedness, and the absolute need for collective action. We feel a new momentum everywhere for an equivocal commitment to come together to chart a course towards a better future. This is why it's crucial for women to be included in all pandemic-related decision-making processes. I look forward to hearing from our esteemed panelists and participants today on ways to make this happen in Kosovo and how the UN family can support inclusive recovery efforts. We will only emerge successfully from this crisis through solidarity with our joint efforts fixed on a future where no one is left behind. Let's do this together. Thank you very much.
Thank you very much, Chief, for your comments. I would now like to give the floor to Ms. Ulrika Richardson, the United Nations Development Coordinator in Kosovo. Please, Mrs. Richardson.
Mirdita, dobro jutro. Good morning, everyone. Dear, pleasure to see everyone, particularly SRSG, and thank you for your words, and also thank you to UNMIC for organizing this event today, together with UN Women and our partners. Indeed, what we just heard in terms of a quote of looking at the COVID as an opportunity for embarking on a new way of thinking, on a new way of looking at policy making. I think that is the opportunity that we have now uniquely in front of us. And it also is the best way to pay a tribute to all the lives that have been lost during this 18 months of a pandemic that really shook the world in a way that we perhaps could not have imagined. So indeed, it is crucial for women to be included in any type of pandemic-related decision-making process. But I would say that it's not only important for women, it is important for our societies. A few things that come to my mind is the SRSG spoke about the moral obligation that we have, and indeed, if you look at the human rights, the Declaration of Human Rights, it talks about all human beings are born free and equal in dignity and rights. And that is, of course, relating to the fact that women's human rights are the full set of human rights. So indeed, we have an obligation here, and additionally, women's rights to participate in public and political affairs on equal terms with men is also constitutionally protected in Kosovo. And so that means that we are supported also from that perspective to move forward with increased women's participation in any type of decision-making as it comes to post-COVID recovery. It's also the good thing to do, is the just thing to do, because we've seen how again this crisis have had a very female, very feminine face, unfortunately. They have been not only part of really bearing the brunt of healthcare, elderly care, childcare, and that has been an enormous pressure on women. In addition to the worry of being able to keep jobs or any type of small companies that women were running. And we had, as the UN family, in particularly UNDP, UN Women and UNFPA, we ran a set of surveys, 3 surveys over the past 12 months. And we've seen that women, even the figures tell us very, very clearly that they are directly and unproportionately more affected by the pandemic than men. Just as an example, women business owners are much less confident that they can actually return back to business and recover from the loss that they've had. Much less confident than their male, let's say, peers. Also, women do not know actually where to get support in terms of both economic support after the COVID or now during the recovery, but also as a topic that we've been seeing terribly put to the surface, which is gender-based violence. There is still a doubt among some women of where do I go to get the support. And I know that part of the panel that we will hear from today will also talk about this. So overall, when you look at decision-making, when we look at policy-making from a government perspective, for me, it would just seem to be the smart thing to do to have women involved, because when you're faced with a crisis, you really need to gather all the competences, all the capacities that you have around you to really be able to think wisely, to come up with the best innovative new solutions, and then obviously implement these in a way that it creates sustainable impact. And then it would seem to be completely illogical if we exclude half of our capacities. It's like you have a team and you just say, no, half of you're not going to be part of this journey. We are just going to decide what to do with the rest of the half. And obviously that from a logical economic point of view, only that would speak in favor of involving women. And we also know that that reminds me very much when we would go out to the municipalities, when you talk to women in some of the municipal assemblies or in the municipal offices, they raise issues that are problems that a man perhaps would not see as evidently as women do, because they're closer to the home and to the household, and that could be lack of water, lack of public transport, etc. And much of this have been exposed now as weaknesses as a result of COVID. To come back to the UN and the UN family here in Kosovo, we've been working with the governments since day one of the pandemic, and I'm also proud to say that the work that we've been doing has also been highlighted by our headquarters. Just to give an example, that UNDP with UN Women, they published recently a global gender response tracker within the context of COVID recovery, and where they actually look at women's participation in any type of COVID task forces, but also in terms of policy measures by governments. And there we can see that Kosovo is actually receiving very commendable mentions in this global tracker. So there has been progress. We've seen some of the financing that have come to particularly improving the position of women. We know that some of the EU-funded economic recovery programs have done so, also from the government perspective. And as I said, we're proud to have formed part of that journey. Many of you around in this virtual room, and also I know in the studio, will also remember the work that we did together with civil society, calling on the need to really step up the capacities of the shelters to be able to receive and respond to the increased demand, unfortunately, that we saw in terms of the increased domestic violence cases. So to say that I think there is a good platform to work through and to start from, but there is a lot that we need to do going forward. Globally, and right now, as many of you will know, there will be the Generation Equality Forum in Paris, and it will raise the need to accelerate results and the focus on gender equality globally. Because with COVID, we've seen the physical, the economic hardships that women have been particularly faced with, but we also know that, in fact, a lot of the gains from the women's movement over the past 20, 30 years have actually been very much eroded because civic space have closed up because of the pandemic, because of also populistic and some opportunistic, of course, political movements around the world. So women's movement really need to have that support, and I'm very pleased to see in the panel that we have a combination of participants, both from institutions as well as from civil society organizations and others. So with that, I know that we're all keen to listen to the panel discussion. I look forward to hearing the debate, the exchange, and also to say that indeed we're in this together. But when we say together, we really need to make sure that we walk hand in hand, men and women, and institutions with civil society organizations, together with us in the UN family, and our other international multilateral partners. So with that, let me thank again the organizers of this very valuable event and opportunity to exchange on this so very important topic for the future of our planet. Thank you very much.
Thank you, Ms. Richardson. Now, to hear more from opinions regarding women's participation in decision-making, specifically regarding the pandemic, we have asked 3 people around Kosovo. Please make sure to use your interpretation function, and let's watch.
Pandemia ka qenë momenti kur është paraqitur nevoja e involvimit të sa më shumë grave dhe mendoj se në këtë moment mund të jepet shumë qartë mesazhi për popullatën globale se roli i grave është i pamohueshëm. Gratë janë të nevojshme në leadership dhe në vendimmarrje, pasi ato mund të sjellin diverzitet, eksperijenca të ndryshme dhe perspektiva të ndryshme.
Ono što je očigledno jeste da žene nisu dovoljno uključene u proces donošenja odluka na Kosovu. Pre svega to možemo vidjeti da nema dovoljno žena na pozicijama na kojima se donose odluke. Čini mi se da ni u jednoj opštini na Kosovu nemamo ženu za gradonačelnika. Jedini pozitivan primjer u posljednje vreme jeste predsjednica Kosova Vjosa Osmani. Iz svega toga možemo da zaključimo zaključimo da nemamo dovoljno žena na pozicijama na kojima se donose odluke. Pre svega, one nisu uključene u izvršne organe političkih partija, zato i ne dolaze na te funkcije. Sve se to preslikalo i na situaciju sa pandemijom, tako da i tokom pandemije nismo imali dovoljno žena koje su uključene u donošenje odluka i u sve te procese.
Shumica e grave janë gjithashtu edhe prindër, apo bartin barën e kujdesit për anëtarët e familjes. Ndonse nën këtë presion, ato në raport me meshkuj janë të zonja, qoftë në zgjidhjen e konflikteve, në shkëmbimin e përvojave me të tjerët dhe me gjitha këto aftësi janë më së afta të marrin vendime të rëndësishme për jetën e miliona njerëzve çdo ditë.
Gjatë kohës së pandemisë është vërejtë që zakonisht është rritë edhe numri i dhunës në familje, kushdoherë ka shku duke pas raportime. Edhe pse më herët kanë thënë që dhuna është diçka që mbetet vetëm brenda familjes, por kësaj radhe e shoh që gratë janë vetëdijsu që ta raportojnë dhunën në familje. Nuk është vetëm burri ai që vendos në proceset vendimarrëse, por edhe gruaja ashtu i gëzon të drejtat e saj dhe është pjesë e proceseve vendimarrëse.
Čini mi se da se situacija sa pravima žena dodatno pogoršala tokom pandemije, jer u prilog tome govore neka istraživanja lokalnih nevladinih organizacija, gde smo imali podatke da je nasilje nad ženama povećano za vreme pandemije, da institucije nisu adekvatno odgovorile na potrebe žena, tako da imamo nedovoljnu uključenost žena, ali i povećano nasilje i ugrožavanje njihove bezbednosti, iako je na izgled delovalo da su žene uključene u proces donošenja odluka tokom pandemije, činjenica je, čini mi se da to nije bio slučaj.
Përballja me pandemin ka qenë jashtëzakonisht e rëndë dhe efekti i saj negativ jo vetëm që është parë në të tashmen, por do të projektohet edhe në të ardhmen tonë. Procesi i planifikimit dhe politikëvërjes pa investim në integrimin gjinor nuk mund të bëhet dhe është e panegocueshme dhe të shihet si prioritet kombëtar.
Pandemia ka qenë një kohë kur të gjithë kemi qenë të izoluar edhe është pa se gratë janë ato të cilat i bin vendimet, jo vetëm burrat. Duke pa që dhe së fundmi gratë ta themi e kanë timonin e tërë botës në dorë, duke pa që edhe në Kosovë së fundmi është emëruar edhe presidentja femër, kështu që po shoh që gratë e kanë atë prioritetin më shumë tani se sa burrat.
Sot shumë shtete dhe qeveri tashmë kanë filluar adaptimin e ligjeve për t'ju dalë në ndihmë grave të cilat punojnë dhe kanë shumë përgjegjësi, kanë nevoja unike si dhe perspektiva për të ardhmen.
Hello, dear guests, të nderuar mysafir, dragi gosti, mirë se keni ardhur në eventin.
Welcome to our event, Open Global Days. PSSP Ulrika Beri, faleminderit.
Guests, pra të nderuar, kam derin që sot të moderoj një diskutim besoj shumë të frytshëm ku ashtu siç e tha edhe SRSG tani edhe Ulrika.
As it was said by SRSG and Ulrika, the purpose is to raise awareness and discuss the participation of women in decision-making, considering the challenges we are all coping, especially women carrying multitasks at the same time. Now I shall introduce the panel and then we shall start discussions. We have Ms. Edi Gusia, the head of Gender Equality Agency within the Prime Minister's Office, Ms. Fikriya Hassani, Principal Legal Officer in the Ministry of Health, Ms. Adelina Berisha from Kosovo Women's Network that manages the programs or projects concerning response to violence against women, and Kadri Gashi from SIFT organization or Council and Social investigations. Thank you for your participation and welcome. I will start with Edi Gusia since she represents one of the main pillars concerning gender equality. With the support they give to women through the institution by addressing gender equality in interconnection in the legal framework and in the work that you have done so far during the pandemic. Ms. Gusia, the Kosovo's program for gender equality 2020-24 aims gender equality to be in the center of all transformation processes in Kosovo, but COVID presented a lot of challenges for women. So we believe that it is possible to have improvements in order to address women's needs after pandemic. What are the possibilities concerning women in decision making? Thank you, Vlora. Thank you for the invitation. As it was mentioned by the predecessors, COVID affected proportionally. Its effect was more powerful and bigger at women because of the cultural norms that continue against the women. So they still are a burden on women's shoulders, not only in Kosovo, but in the entire world, because the world statistics say that COVID affects more women in this direction. But Kosovo, in the middle of this pandemic, we can say that the Kosovo government has had a very agile response and very careful one. So by opening the first shelter in quarantine in May 2020, and we saw that domestic violence had been increased, and the government created a shelter for women that could not go to the government-run shelters. But at the same time, it has been managed as of January 2020 up to December 2020 to have shelters that would take care of the domestic violence victims and sexual violence victims. And above all, in cooperation with the gender equality agency at the peak of pandemic in May 2020, which was indeed a very positive reaction of the government because Kosovo has a considerable budget and it has set priorities for the advancement of the gender equality agenda in having in focus women and girls. Starting from this strategic document, for us it was easier to integrate a gender perspective in the further economic recovery platform, and it had a strong support of our international partners, and that's why I thank the UN Women for the economic assistance, not only for the Gender Equality Agency and how to orient better the assistance at the categories in need, but even in the shelters established by the government during the quarantine time. And we managed to integrate the gender perspective within the agency, and it was allocated 2 million euros to address women's needs. We historically know that women are oriented in the services sector. Since the first lockdown, they were the private kindergartens. And in addition to being raised as businesses which were run by women, they mainly hired women, and they would disable mothers and parents not to have places or not to have enough kindergarten to send their children. So that the agency in October 2020 distributed money for 30 kindergartens, and from those 115 kindergartens, 85 were led by women, and the staff that was engaged, 114 women worked in these kindergartens and 65 men. Also in these kindergartens, about 6,500 children were included, which is a quite large number, and it was a very special experience for us because private kindergartens were supported for the first time by institutions. At the same time, they were provided economic and financial stability, which was more than welcome for the for the sake of the critical financial situation we are going through. 1 other million euros were allocated mainly to 24 NGOs, women NGOs, which work on the ground in rural and urban areas. There is a geographical diversity. They are distributed in the entire Kosovo, and for the 24 NGOs, 650,000 euros have been allocated, and for the women leading small businesses they were allocated 2,700 euros. And the government managed that in the Fund of Economic Recovery to absorb or to shock the effect of doing business by COVID. And it was seen that it was very difficult for women to go back to the business because they mainly lead the small family businesses and they hire very little number of workers, and their skills to ask for help are relatively lower than of men, because men have a practice of cooperating in searching for work with international partners, and they are more voiced. And we have seen during the time when women applied for a job, and especially for small businesses, despite the fact that there was a very simplified application form, but they had concerns and hesitations, and they consulted us, and they saw it necessary to be reoriented in the future. So when we go from COVID and empower women, how they will win the skills to ask funds and to raise their financial abilities. As an agency for gender equality, it was kind of an experience, a challenge during the pandemic time, and we saw that it was necessary to work with women, especially in the system of applying for a job, and the financial system, and the financial bank trading. And maybe this is one of the moments that escaped us, because women hesitate to ask for loans because of the lack of financial skills and abilities, how to ask for funds in order to provide a stable business of theirs. Thank you, Eddie. A very interesting perspective that the international partners in the future, when we do our plans, to have in mind. We also tried through evaluations in the field to provide information from the institutions so that the plan would be set up based on facts, and these were some of the main findings: unpaid job, knowledge to apply in various grants. And I believe that our cooperation with you will continue in the future, so that we can have economically independent women and empowered. Ms. Fikriye, you also had a very serious burden during the pandemic time. I will start from the perspective, since we are mothers, sisters, and workers in the healthcare, with all those roles that you had at the same time, and at the same time, the increase of the domestic violence cases was one of the key problems, and you coped during your work in the field. During the pandemic, health institutions dealt with more cases because it was increased in Kosovo as in the other cases, the cases on gender issues. We would like to know more about the protocol or the process that you have applied during the identification or treating domestic violence cases during the pandemic, and if you have seen any change, especially in the approach that women had towards the service and towards the staff against the women, the health staff. Thank you very much indeed for the...
As you may have noticed, during the pandemic, the infirmary has had a very significant role, and I would like to thank them on behalf of the Ministry of Health for their contribution during the pandemic. You mentioned the greatest number are of female gender who gave their contribution. We think we have overcome this pandemic. We haven't had any collapse, regardless of the fragile health system in Kosovo. Compared to other countries, our nurses have been quite dedicated, committed, despite of other commitments that they've had and the challenges they faced throughout this period. As far as your question is concerned for service provision for women, it's true that we've had an increase of domestic violence. Services have been provided to all, and there is no specific protocol. However, most of the nurses and doctors are trained to identify violence in cases when they don't declare it themselves. Although, fortunately, the awareness has been raised among women, and cases have been reported more than before during the pandemic. Unfortunately, we've had an increase of violence. The treatment was done in the clinic as well as in the emergency center or wherever they've reported. But from the Ministry of Health, we noted that we lack a guidebook, a manual to treat such cases of domestic violence and sexual violence. So this is a future plan to have a guidebook drafted. What they do prior to a case, besides the evaluation and the treatment, we notify the police. Then we have the psychologist and the social worker. So we have this team of workers. We have also this international standards in place. So for more details, we will prepare a special manual that will help the nurses and all of these health workers to provide further treatments. As far as the question if we have noted any changes with this violence and the services provided, including the access to services for reproductive system, I can say that there were no differences in treatment. About 90% of cases have been treated with reproductive services, be it pregnant women, births, or other cases, carcinoma or other gynecological problems that they've had. They were treated in the OBGYN clinic. We've mentioned in other cases during the pandemic a significant role has played the private system. They've had the possibility to offer services as well, but also in the university clinic and the regional hospitals where we have our OBGYNs, we have provided services constantly. There were no cessation of service provision. I can also provide another figure, an assessment that took place last year. This is from the doctor that gave the assessment. We have a rapid evaluation of services for reproductive services. In 2020, the assessment was made until September, and therein we have in Kosovo for reproductive health, we noted that postnatal deaths, we've had only 2 during this year. Of all the cases until September 30, 2020, during the pandemic, 57 pregnant women with pandemic were treated, and we've had about 15,600 cases, but 57 were pregnant, and we've had only those 2 deaths as a consequence of COVID. The first one was older than 40, and it was her 3rd birth. She had other health problems. The second one was 21 years of age, and she was in her 6th month of pregnancy. but earlier we haven't had any increase, so the treatment was for all. In the gynecological department, we've had a special department that treated women that were affected by COVID. Thank you very much, Ms. Fikri. I would just like to repeat that not to you, but to entire health care workers, we owe a big thank you, because you have been available 24 hours during this period of pandemic. Thank you once again for your participation. We will have another opportunity to discuss further. We would like to go back to Adelina from the network. As you know, the women's network in Kosovo are always quite voiced, quite active, but during the pandemic they made sure for the women's voices to be heard, not only in decision making but also in reacting to domestic violence. The discussion for women participation to be maintained in the highest pedestal. So we would like to continue by referring to a report which is called A Chair by the Table. So a women's network through this report tackles the contribution of women in all of the sectors, in particular in peace and security, than the healthcare sector. And as we said, hundreds of women have provided their contribution in the healthcare system by providing access to healthcare services during most difficult times. However, yet their role remained a bit invisible. So what was the role of women's organizations during this global crisis in Kosovo as well? And what do you think, how can we make certain to have the women's contribution recognized and have women be more involved in all of the recovery plans, not only in the institutional level, but also on the local level? So the report that you mentioned.
The report that you mentioned was mentioned by this. It happened in our society, even though women took part as fighters and nurses and doctors. Their contribution has been recognized. We had to struggle in 1999, especially we activists and the women organizations, in order to recognize this contribution. You know that there were changes in the legislation for this to be recognized, but the history of not recognizing the contribution of women is being repeated. And the discussion that we have been doing so far is what is the importance of women, be it through the provision of services offered by women or as carers of family members, as a part of the society that we are. As in the entire world, women organizations have been found unprepared by the pandemic. They have been touched by challenges, starting from the lack of funds, because some organizations had to replan their funds to turn them into emergency assistance in the project that they work. They are left without means to pay for their rents, and you know that the start of the pandemic and the panic that was reasonably caused for the emergency measures, masks, disinfectors, they were not planned in the organization budget in order to provide them. So there were mentioned organizations that work with marginalized groups, and the work with these groups is important, and it has been minimized in this world. The women had to orient their work in order to provide such a help that they work with. We mentioned the shelter challenges, although the reaction of the government was fast, but the first 2 months, nobody knew what was going to happen and how we should act and how long it will happen. And shelters had a lot of challenges. And maybe they affected in the provision of services for women in need. But what we should always appeal, and we continue to call for, and it is also stipulated by the law on gender equality, Every decision-making process should involve women. Therefore, there should be calls in the central and local level, be it directly through women organizations which represent the women needs, either through the use of women's organizations, through bridges, to use all of them, and our contribution to continue to go in the right path. We would like our contribution to be recognized by decision makers, and we know that it has been recognized. That's why we are here together. We are speaking on equal terms. But the important thing is the welfare of our citizens, women and girls, and that's why we should be used in a way, women organizations, and to create a discussion, and women need to go to the right address. We know that for discussions at the local level, in municipal level, women take part in small numbers in these discussions, so they should be invited to take part, and we hope that the situation with pandemic will end soon and we shall return to the normalcy. But we don't know what is going to happen in the future, but we wouldn't like to happen this in the future. So women's interests should be taken into consideration. Women should be consulted. Women NGOs should be consulted. And if we should make a strategic plan coming from women NGOs, they should be part of every decision-making process where women's and girls' needs are presented. We had a good cooperation with the Gender Equality Agency, Ministry of Justice, and with UN Women as well. We signed an agreement at that time, and we hope that women have managed to benefit, and it was tried. Even though it was a period of crisis, many women and men lost their jobs due to pandemic, to create some possibilities, at least for women which are in a shelter, and to see if there is any possibility for their employment. It is very important to recognize their contribution, to recognize each other's contribution, and to respect every citizen. Because when the welfare of all women and girls in harmony with all the requests and needs, the society in general will win. Thank you. Adelina, we shall have questions and to discuss further with you. Kadri, thank you very much for your participation. As I said, Kadri heads a more specific center. It's the counseling and social services and research. An important work done by Kadri within the capacity that they have is the work with the violators. And as we know, the cases of domestic violences have been increased. And seeing the call for it appeal, it was a special appeal for their rehabilitation in this pandemic time. Knowing that the rehabilitation and integration are one of the main aspects in preventing domestic violence based on the Istanbul Covenant. Can you tell us how pandemic affected in the work of your organization, the challenges that you coped with, the approach with the violators in the ground? How did you manage to do your work that good? Thank you, Vlora, for your invitation. Initially, I am a parent myself, and I want to interlink with my predecessors. Unfortunately, the situation before pandemic was not satisfactory concerning inequalities that exist in the family, especially towards women and girls, compared to women and men, to boys and men. My experience, 15 years experience working with men and young boys, was prevention of negative phenomena in our society, especially in the promotion of gender equality between couples. The situation, unfortunately, impacted that the number of the cases to be increased, and I think this impacted in the citizens to report the cases. As an organization, we tried as of 2018 to work mainly in addressing issues in the rehabilitation and the integration of the doers of the action. There was a prevention, and we tried in different aspects, not only through schools at the elementary and secondary level, but even with various universities to raise the issue of prevention, because it is the best means to come to the request, and then when we know that the confirmation and the awareness is bigger at those people who commit such criminal offenses. Our work has been focused in various initiatives before pandemic in schools. For your information, so far until 2020, when pandemic started, from my experience, most of the men and boys, most of the persons in our center are men and boys who come to ask for counseling services, professional rehabilitation. It has been proven that they lack a discussion with various persons or people, because as we know, Kosovo is a parental state which is dominated by men and boys. They give importance to boys in employment, as it was mentioned by my predecessor, so that our job is mainly to work more in prevention aspect. And we saw that one of the biggest challenges, because of non-seriousness, we thought that to work in rehabilitation, it would be a good opportunity, because the various conventions, not to mention them because of the time, from the Cairo Conference and Beijing Covenant 1995, where they sought to include men and boys in gender equality. So in this respect, we should work in the rehabilitation of the doers of the action, because men are as well victims. They could be in a family which, because of the education, because of the social and economic situation, because of the lack of knowledge, men are also frequently a victim. So many statistics before the pandemic, during the pandemic as well. If we speak of since we speak of the pandemic, in May 2020, we managed to do a research with some men and young boys. Unfortunately, Kosovo leads concerning gender inequality, normal habits concerning the inclusion of boys in care, concerning the prevention of violence, and concerning various diseases. Kosovo still leads in the Balkan countries. Kosovo is in a situation concerning the abuse with alcohol or narcotic substances. They stand a little better compared to the other countries of the region around Kosovo, so that the work in the rehabilitation for us was a very big challenge, because in addition to the lack before the pandemic, these persons who asked to be, and those people that refer to us, they came voluntarily, because it's good to explain this one. In 2021, institutions saw it important to refer them for counseling at us, police prosecution office courts, and we have managed to achieve not a agreement, but based on the current law, to refer the cases to the Center for Counseling based on the standards that we practice in our center. We base on European standards, EU countries of Switzerland and Albania, and we tried to provide these standards to these persons and to the other institutions, so that these persons can be enabled a full rehabilitation up to a full integration, so that they would not repeat the cases of violence. When we speak from legal framework, I'm speaking in the context of Kosovo, we are obliged, since we are speaking of pandemic, and we have the Istanbul Covenant. It was mentioned by Vlora. One of the criteria is the work, not only the research work, but the rehabilitation and integration of the perpetrators. And I think that we should jointly should take the work seriously with the perpetrators, because unfortunately they happen every day and we have cases of victims, and it troubles us more than the institutions, because these persons are not offered a proper counseling service. It's a special service which is not touched by the clinical psychological part of the perpetrators, but from the emotional part. And I think in the context of Kosovo, it is an initial intervention is asked for since its beginning, because we should go back to the time when he was brought up in a family, whether he was a violator in his family. I think that men and boys should not be seen as an obstacle. They should be seen as allies. And I am one of the men and boys who started working with men and boys because I saw it very important to work and contribute as concerning the states like Kosovo, and I tried to help these men and women working in gender equality. Unfortunately, education system in Kosovo is to be liked. We have obstacles in the curricula, such as reproductive health and sexual health. Ms. Richardson mentioned the reproductive health, and the educational curricula started to include some books that they include these subjects, but I think more should be done concerning gender equality and the prevention of violence, to start with younger generations at early counseling, because it helps the family and the society to have less cases and to have more boys and girls informed concerning the early prevention and negative phenomena. As far as the general equality, I think that especially in the kindergartens and early childhood, the success would be bigger, and we would not have to deal with the perpetrators, because the cost and energy is bigger than we prevent or anticipate.
Thank you, Kadri. This is one of the items, or one of the topics that we had in all of our discussions. I think our children are still quite exposed to gender stereotypes in books, fables, different stories, in school material. And I believe that with the advocacy of the organizations and the work of the institutions, this issue is being treated and tackled, that drafted a manual with the CDAS financing with regard to stereotypes in school books, a manual that should serve to the those that draft school books on how to eliminate gender stereotypes, not only the new to school material that will be drafted, but also in the teaching process before the children, in order to have more balanced models in the gender aspect, as Mr. Goshi mentioned, to encourage children from the early ages to be curious and raise issues of equality, because gender equality is at the very core of human rights. Thank you for this. I believe this curriculum will be revised very soon, not only sporadically, but in a proper way. Once again, we would like to thank all of the organizers, the UN family, for this event. As you know, this event is live on Facebook and in the other social media, and participants and other guests via Zoom can post their questions in chat. They are being monitored. I believe that we are ready to begin with the first question from the audience. So can we begin? Questions for the panelists?
Ja. Kako? Da li se čujemo? Dobar dan.
Can you hear me? Very well. My name is Angela. I'm from Gračanica. I'm a journalist. Greetings to all of the participants in this event. And in the beginning, I must express my disappointment because I do not see in the panel any of the representatives of minority communities today due to the circumstances. The day of the Egyptian community, maybe one of them could have been there if not from the Serbian, Bosnian and Roma community and the others. Can we just clarify? You are right, but we've had guests who cancelled at the very last moment, so we had to change our agenda. Can you hear me? Can you hear now? Yes, I can hear now. I hope you probably thought about Ms. Emilia Recepi, but in my opinion, she's the representative of all of the citizens in Kosovo. At least that's how it should be. But nonetheless, let me go back to the topic at hand. This was in good intention, as is the message of the UN, to think about to have more employed from the minority or non-majority communities, as the Constitution stipulates, just to have a better summary of the or statement of the situation. But this is my suggestion, as coming from one who's out there on the field and sees firsthand the problems men and women face as citizens of Kosovo. Currently, the most important part is the COVID recovery for all citizens, and of course, I think for the support for all, and in particular for marginalized groups. And yet again, I speak as someone who is out there on the field and comes and meets all of the communities, in particular young ones, women, of course, in particular women from non-majority communities. As a journalist, what I am certain of, and something that I have all the proof of, is that the institutions, regardless of everything that I've heard in the presentations of my colleagues, commendations mainly. Unfortunately, I must say that institutions have not had the same or equal relationship with the non-majority communities and those from the majority communities. If they had, then the information was lacking for the same citizens in some other official language, i.e. in Serbian, and during the pandemic, the lacking information was directly influenced the life of citizens. I'm sure you are aware of that. First of all, I am talking about the information from the Ministry of Health and from the Ministry of Interior, which during the pandemic have been the most significant ones for all of the citizens of Kosovo, in particular those coming from minority communities who could not know how to behave, what were the measures in place, let alone the vaccination process. Wherein in Serbian environments now vaccines were offered from the COVAX program, which is a different topic, I'm sure now. I know that UNMIC and OEPs and many agencies, international organizations, as well as some of the embassies have given their maximum during this pandemic for capacity building with regard to the interpretation services. This may seem irrelevant to the topic to you, but of course it is relevant because you spoke about honoring human rights, honoring the rights of women, of equality. However, the law on languages is the foundation for human rights, and with that, gender equality. I hope that you understood that my comments are with good intentions, and for the members of the panel and maybe UNDP and other agencies, but maybe for the special UN representative, when will they and can someone help to let us understand that Kosovo institutions have a good political will to solve that problem, but do not have capacities? How to overcome this to finally do not have this language discrimination where from all of the problems derive? Does anyone have information? How many women have been jeopardized during the pandemic? Women from non-majority communities, women that have been victims of domestic violence. Plainly, lack of information in the mother tongue causes various problems, and with that incapacitates the integration of minority communities in Kosovo society, and with that shows that society is not democratic enough or multi-ethnic as it should be, or as it is stipulated in the constitution that we all know. Thank you for your attention. Once again, my comments are with good intentions. I am someone who works between institutions, organizations and citizens, and it is my obligation to inform the public with all of the events in the Kosovo society. And if we do not have that fundamental right, that is the use of language, then this becomes impossible. And with that, minority communities will have less trust on Kosovo institutions and in international institutions that you here represent. Thank you for your attention. Greetings from Gračanica. Thank you, Angelika. Do you have an answer? We now have a comment from Ms. Fikriye. Greetings to the lady from Gračanica. I just wanted to say, she mentioned vaccines. During the first stage of the national plan against COVID, the vaccination took place in the harmful elderly in Gračanica and in Pristina. So this took place because in accordance with the national plan, in the first stage, those older than 80 were supposed to be vaccinated and in the homes for elderly. Of this I am certain. In the second stage that we are currently in, from the Ministry of Health appointed 2 doctors that will regularly go to the family medicine in Gračanica, and these days will continue with vaccinations in the Gračanica region through the main center there. This is an accurate information. As far as the other information is concerned, I don't have an answer yet. We are working in preparing all of the information in Albanian as well as in Serbian language. I believe you will receive all of the information in the necessary language. I think you had a comment, yes, from the women's organization. I can say that when we helped the organizations, we have about 160 organizations that represent all of the communities living in Kosovo, all of the women from different beliefs, different ethnicity, and so on and so forth, among which we have organizations representing Serbian, Roma, Egyptian, Ashkali, Turkish, Bosnian community. We are fortunate enough to have a shelter in Novo Brdo, which is specifically for Serbian women of that region. And we have the organization Žensko Pravo, which is in the northern part of Mitrovica and provides services for women living in that part of Kosovo, and who speak Serbian, Bosnian, or whatever language that is more comprehensible to them. Throughout this year, with regard to the help that we provided through UN Women Funds and Austrian Development Agency, these two agencies benefited as well, and with direct funding provided psychological counsel and legal counseling for victims of gender violence. But we had awareness campaigns on the forms of violence that was done by the organizations Naš Dom in Novo Brdo. They went out, met women and informed them of their rights and the services that they provide at the shelter. We cooperated with organizations who cooperate with Roma, Ashkali, Egyptian community to raise awareness on forms of violence and where can they report violence during the pandemic, but also outside of pandemic. As women's organizations, I think that we managed to cooperate with the organizations of all of the ethnicities and communities living in Kosovo, and wherever possible we use the language of these women in order to send the message properly. I think we have the local level as well who are responsible for interpretation and the use of that language if the information came from the central level, and make certain to translate them. If I may, I understand the concern of the lady in question, because in particular in emergency situations, it's true that there may have been delays with notices and information, but information appeared automatically after a certain period of time in Serbian language as well, as far as the gender equality agencies are concerned. As of the first publications or notices from our international partners that have been disseminated through our web pages, they have been distributed in the languages of other communities, but also the recovery in the first round of financing kindergartens and NGOs. The calls have been in Serbian, the forms have been translated into Serbian language, but also the beneficiaries, in particular in the regional level, there have been beneficiaries of different communities, not only the majority community, but also as far as the Gender Equality Agency is informed, there have been an outreach throughout the country. But it's true, this is a learning process, and the pandemic has sent us different signals of our vulnerable points in order to advance our gender equality agenda, but also send the information properly without any exclusion of gender or national level.
Thank you. As I understood from the perspective of the UN family, and the assistance that we have provided was distributed to all communities in all the campaigns that we have organized together at that time with the Prime Minister. And we said that since the beginning of the pandemic has taught us many things that we thought we have known, but in fact we didn't know. So that this will be a learned lesson, and of the report that will come out, we shall have in mind the request in order to further address, in order not to have such situations in the future. Now I shall open the question coming from Zoom. I was informed by the director, it's Ms. Sakiba, the director from the Jakova shelter, which was a shelter project and overburden during the pandemic. If you are ready, we can start with the question. Hello, hello to everyone. I wanted to thank you for the event, and I express my appreciation for the help provided by the UN institutions, Gender Equality Agency, especially Newman, who stood close to us and we could cope with COVID. Despite the large number of victims that asked for help during the pandemic time and that ask for help every day. We know that being supported by our government as of 2006, but this support is sporadic because it happened that every year we would remain without a budget support. The strategic support of the Ministry of Justice anticipates the creation of a special budgetary line for shelters. And with the domestic violence victims and trafficking in victims. So where do we stand with the distribution? What are the challenges in creating this budgetary line? And where are they addressed in order to overcome this challenge, at least for a longer period of time? Thank you. I believe that this is the question. Thank you, Dolly. As you said, the Kosovo government has been financing the licensed shelters by the Ministry of Work and Social Welfare, which is the part of the Ministry of Transfers on a regular annual basis. And I think that we should mention that it's a good achievement because there was a stable financing and shelters were financed by the government of the Republic of Kosovo in the amount of, if I'm not wrong, 650,000 euros in total, including the trafficking shelter. There was a financial help from the UN agencies, from UN Women and UNDP, and this continues to remain one of the priorities of the government. We had recently a meeting with the Parliamentary Commission on Human Rights Missing and Petition with the Deputy Minister of Justice, respectively the National Coordinator Nita Shala, and we as a Gender Equality Agency, representatives of the institutions that treat the domestic violence case, and I think that the government will continue to support the shelters. We shall find the modalities more adequate one, because the present one, if it is respected in precisely, if we respect the deadlines, it provides a sustainable finances. We had the changes in governments and many a time all institutions and shelters coped with the process of government changing. So when the budget of the government was to be approved, the political situations affected this sustainable financing, and it also affects other areas. But it is important that the government program of Minister Kurti, the fighting of the domestic violence phenomenon, is one of the highest priorities because they will continue to work for the shelters to have a sustainable financing to be evaluated. And as we know, in September 2020, the Istanbul Convention in pandemic time, Kosovo passed a test in the gender equality area. It approved the Istanbul Convention as part of the local legislation, which opens the way for the sustainable financing and for the provision of qualitative services that will be monitored by the state. As mentioned by Mr. Gashi, it will be very important in addition to providing direct services for the victims. The focus shall be important of the perpetrators not to repeat the cycle of violence. and the financial help of the survivors of the domestic violence victims. It should be high in our priorities in order to remove them from this cycle of violence. Thank you very much, Eddie. We have a question from Zoom. As I understand, the question is from Mr. Rudy Hoja, who heads the Patients Association, a very important organization. Ms. Reja, I believe you are ready for the question. Yeah, we are listening you. We are hearing you very well. I greet everyone present, the organizer, panel members, because the topic is quite proper. As an association, we deal with the patients' rights. I am the executive director of the association, and we deal with the protection of the rights of patients. I can hear an echo. I don't know if you are listening to me. We are listening. We are hearing you very well. During the entire time of pandemic, we have monitored all the activities during the reaction of the work of the Ministry of Health, of hospitals, as well as of the other institutions. But one of the strategic problems we have identified and we have reported to the highest instances of the government of Kosovo is that during the pandemic, Kosovo government and the Ministry of Health later, they reached a decision to stop all healthcare services but COVID. And we had a question earlier about the number of births in pandemic time. But as the representative of the association, as the government, I would like to know all the expenses in addition to births. Where are the needs of the others, of the checkups? They were forced to go to some other sector, not to say in the private sector. And what were they able to do in the condition outside the market? This our concern for the interruption of the healthcare services has been addressed to the ombudsperson as well. And he has been informed that it is an elementary violation of human rights. Because of the interruption of these services, we came to the conclusion that the number of people has been increased, not as a result of COVID, but as a result of the interruption of health services that the institutions were obliged to provide. Because the patient during the pandemic, no matter men or women, had no other place where to go to ask for the healthcare treatment. A bit later after that decision, we had another sector another decision that the private sector has been allowed to provide healthcare services, and the state one dealt with COVID issues only. We again raised the question, what has been done with vulnerable groups that did not have sufficient means to treat their health in private sectors. There are many other concerns in our association, and I think that I will get the answers as well. And also to the part of the recovery, economic recovery. And everybody says that there is no better recovery, or because in addition to the healthcare systems to be more efficient and to provide better results, even for the men and women and for everyone. This is what I had. Thank you, Mr. Reja. I think that Ms. Fekria will give an answer. But of course, we shall have the possibility to discuss later. Thank you for the question, for the concern that he raises as a patients association. During the 8 months of pandemic, I can only give some explanations in view of the information they were given by him, but concerning the population which was more vulnerable, chronic diseases, pregnant women. In all centers of family medicine, more than 20 of them, there is a service for home visits. During the pandemic, the decisions disabled us to directly contact the parties. As we said earlier, the pandemic taught us many other things that we didn't know. And as a population in general, during the pandemic, at pregnant women and after delivery were not able to be visited by all, but we did counseling through the phone. I did not get my statistics, but I can tell Mr. Reja, who provided this information, we gave support to all pregnant women and after delivery according to the protocols that we have for home visits. With 20 centers of family medicine, it was maybe not inclusive, but from 30 centers, 20 of them offered counseling through phone for all citizens that had diabetes and hypertension, because we have centers for counseling and the nurses answered the phones and provided help. So it was not only for women, but for the entire population. We had vulnerable groups, such as the ones with the tuberculosis. At the beginning of pandemic, they were equipped with medicine for 3 months in order not to move, so that they would feel safe and continue with the therapy. Let's not forget that the Ministry of Health had and still has the emergency operational center, which were 24 hours a day. Now it were 12 hours a day, and it always gave explanations through phone to the population, to the citizens that asked for it. And we also did the coordination, the patients that were locked because we had a restriction in movement. Through the centers of family medicine, the team went to provide them with medicine. It was a challenge for everybody, but not that they were violated from the receiving the services. Concerning regional hospitals that dealt with only pandemic, let us not forget from the large number of infected people, and the clinical center should have been reorganized in the services in order to provide more qualitative services during the pandemic. The ministry also made the plans to restore the step-by-step provision of services in the specialist ambulant. So we are carrying out surgeries that were previously interrupted because the number of infected people has been reduced, and most of the centers were involved with COVID, and now we are recovering. I would like to appeal to continue with the vaccinations because it is the only way to protect the population and to return safely to the processes, not only in healthcare but in general. And I believe this process, according to the national immunization process, is going well. Thank you very much indeed. We have another question for you from Biljana, who is an advisor for the OSCE for gender equality. You gave the statistics for the death number of mothers. Do you have statistics for the death of the newly born babies during the pandemic time as a result of COVID or because of the health other problems? Thank you for
What I said earlier is that a rapid assessment has been done from 13th of March to September for the maternal deaths. This was the assessment. That was the focus of the assessment. As I said earlier, one baby is alive because we had the cesarean section, and it was the 36th month. The survival was certain, and with the intensive care, the baby is all right. Whereas the other one, besides the maternal death, the baby could not survive. For other cases, currently, I'm afraid I do not have any statistical data, but I believe the statistical agency should have all of the reports from the 2020. Thank you very much. If I had had this question earlier, I would have obtained the data. I would like to know if you have any more, if we have any more questions from the Zoom chat or not. Very well. Thank you to all for your questions. Before we close the panel, I would like to ask you if you have any final message as your contribution in this discussion. Please feel free to share it with us. If the pandemic has taught us anything, it is that human civilization is very vulnerable, it's very fragile, and it can be harmed in numerous ways. If we need to have some lessons learned from this pandemic, what to do, what are the mistakes that we made in order for us to have a global strategy in place to react to such risks in order to save the lives of people, of men and women, boys and girls. And this should be a learning process, constant learning process for all of us as an agency. We would like to take this opportunity to open a dialogue with our international partners in order for the assistance in the country to the Kosovo citizens in such situation to be more flexible. I shared the UN Women example and UNDP and UNFPA, which were rather flexible in service provision. This type of assistance should be addressed by other partners in emergency situations. As an institution, it was a lesson that we learned, that the legal and financial framework was rather rigid in emergency situations, and it maybe requires some additional thinking, a different plan on how to act with the legal framework to manage the public finances in such situations that affect the lives of all of us. Adelina, the emergency headquarters have had, because I forgot to mention the participation of women in the headquarters, and in order to relate to what you've said with the participation of women in decision-making processes in pandemic and during crisis, if you could please provide a comment. But this is a form of recommendation. We've always said not to neglect the women, as in particular civil organizations led by women, whether drafting measures, short-term, mid-term, long-term, and consult women's organizations, but also gender equality offices in municipalities and ministries to better comprehend, as I said earlier, to raise the needs of women for budget planning as well. We also we always called for the gender perspective in budgeting while drafting. This is not only during the COVID, during the pandemic, but throughout the decision-making processes. A call that would be very significant for the financial support to allocate sustainable funds for women's organizations, because we can see that the role and the tasks they provide and their services are very important. And I do not mean solely of the organizations that provide the directly services, but also organizations that are experts in monitoring research, because we must see if the budget was proportionally allocated for men and women, and to provide recommendations which can further be used in drafting other budgets. Therefore, I hope I managed to answer your question, but it's highly necessary to have the women's inclusion in these decision-making processes through the gender equality offices and organizations, but also public debates and discussions where they will have enough space to discuss. We may be just in numbers there, but the opportunity or possibility is not there. So we do not want just to fulfill quotas and numbers, but we need quality to have our voices as grounds and reach the proper place and be addressed properly. Thank you very much, Delina. Ms. Fikriye, yet again, with regard to decision making, because you have been in the front, in the first line, it's important to hear the voices and the needs that you have as women in the health sector. Your recommendations or your comment, as we said earlier, and the statements from ministers and the population, that the crucial role have had health workers in managing the pandemic, nurses in particular, and those that are women. What I would like to have as a recommendation, considering the importance and the role, significant role they have, to work more on their strengthening and empowering them, assessment through payments. There were differences always that were made, but all this organization and the fact that we did not collapse during the pandemic was the result of the good work of the directors of the infirmary stations. We've had 7 directors, of which 5 are women. I think this is their success. So I would like to call upon the position of the director not to be terminated in the clinical center. In 1999, it had been terminated. It's not fair that to have that position terminated with reorganization, because it is very important, not only of the role of nurses, but of women as well. During the pandemic, the director of the infective clinic has been a woman. This is one of the reasons why we've had very good decision-making process, and I would like to thank her for the contribution, and to all of my colleagues, regardless of gender, women or men, for their contribution and the sacrifices they've made. I believe we will work even more as the Ministry of Health in defending their interests and their empowerment in the future, because this has been a pandemic and we hope we will overcome it, but we will have different other challenges which we hope to overcome together. Thank you, Ms. Fikriye, that you are illuminating, you are shedding light on the contribution of these women, because they do not have so much access to the media, and we hope that through these discussions we can at least mention and notify the opinion of their contribution. So thank you very much. Kadri, since you are the only one here, I hope you did not feel marginalized. Thank you very much once again. and from you as well, we expect a concrete recommendation. Knowing that we are in the stage of the Istanbul Convention, the review of the law, the new legislature, so a comment is very welcomed. I would just like to relate to what Ms. Gusia mentioned earlier on the work, how much have we been prepared. All of us as a civil society, we have been totally unprepared, and this have given us the opportunity to reflect and work with more advanced programs and services. But in a way, it made us understood, not only boys and girls, but also men and women, on how to reflect in such situations. Unfortunately, I think the pandemic has affected all of the categories, and as far as the violence and other services adequate, essential are concerned, mainly girls and women have been victims, and I completely agree with my colleagues, but I think men have been in a way isolated because of the social norms that were created here. They were not given the right to be exposed in the sharing responsibility in the family. They've been exposed outside of the house. So the number of cases this has affected during the pandemic. But what I would like to have as a recommendation is not to work in the national level that much, because I hear I am a parent of 2 girls, and I am a role model with them, and I try to defend the rights of all, but I am for gender equality, not only in the national level, because fortunately women representation in the national level is noted, and we have a model of successful women, and this is very good for Kosovo. We have a president, we have a director of the we have the director of gender equality, who is doing an immensely good work to advance equal rights, and I think this is her role. But I also think that in the local level we need more. I think we need to do more there. I'm coming from a civil society, and I believe Adelina can agree that unfortunately in rural areas we have a very alarming situation. We must work with families. I'm one of the greatest criticizers of the policy that to create a ministry for family, to work with families in particular and break these stereotypes with families and give the equal rights to boys and girls and have their inclusion in leadership, because most of the girls have capacities and knowledge and can contribute in early stages in the different processes in the economical sector, but also health and policy making and different other fields. So this shows us that we must work more in national level. Oftentimes we see women as role models, but I think that we must explore more and consider the capacity of other girls and women, because they cannot promote themselves due to the lack of space. So I think this is what I would like to see from men and women and boys and girls, to have them be empowered more, but also those who are discriminated financially or socially or economically, and so on and so forth. Thank you very much, Kadri. I agree completely. Oftentimes I mention this discrepancy in leadership in the central level. For example, 14% of women in the labor market, while we improved the picture of women in leadership, unfortunately it's not reflected below. So we have a lot more to do with the participation of women in the labor market. And this is closely related to the local level. Thank you all for your participation, for your contribution. A novelty that we have here is the illustration of the conversation through our illustrator. I hope we will connect and to see what we spoke about figuratively and see the drawings that she has to present.
We can't hear Tracy. Okay.
And I'm going to share back some of what I've captured over this very interesting conversation. Some of it you're already very familiar with and you've heard multiple times, but I'll reiterate some of what I heard to frame it and then point to certain sections that I think may be interesting to you to reconsider and hear again or see again, as it may be. So in the beginning, we heard about the women in Kosovo being at the front line, obviously having loads of challenges. Everyone feels that women need to be involved in every decision, must include women. After a little impact there, a gavel. There was a lot of setbacks from what I heard to gender equality in the region because of COVID, and it reduced access to sexual and reproductive health information and access. We won't recover, meaning, you know, the situation won't recover without women's participating. Everyone agrees to that. I captured a little bit here about how, you know, people cannot be left behind. And there was a wonderful quote, which I can't remember offhand, about getting from one portal to another. That might have been attributable to Androti Roy. And in terms of the panel, a lot of the comments I tried to capture when they were translated into English. Most women are parents. The severe effect of the pandemic will be felt in the future. Obviously, this isn't something that's just taking place now, and when everyone's vaccinated, it's all gone. We wish. This was a wonderful quote by one of the panelists. Violence remains, well, that's not a great quote. Violence remains within the family, but women have the wheel of the world. That's the part I like, at their disposal and in their hands. So we need to look to them. It was pointed out that the government of Kosovo was actually very agile and very available and did a lot even in terms of homeless shelters, or maybe you referred to it as something else. If I can find my drawing, I'll be able to refer to it better. The Kosovo Shelter for Women. A question was asked whether within that structure, if there might be opportunities for employment for the women in the shelter. There was obviously a lack of funds, and the panic marginalized a lot of groups. We heard some of the questions regarding, from one of the journalists, whether the Roma, Egyptian, Serbian, and Turkish populations had the access that they needed, and how critical it was for language not to be discriminated against. It's fundamentally important that people communicate in their language. Obviously, it took time for certain systems to ramp up and be available. I know I'm jumping back and forth, but back to the key factor is that the disproportionate impact of COVID was on women and girls, and there was also a loss of physical space, obviously, with closures for people to meet and access. I think we know that the event is live on Facebook. I don't remember how to draw the logo, nor do I remember how to draw the Turkish flag, even though I was in Turkey in April, so forgive me. But the Istanbul Convention was mentioned and referred to in terms of financing of services, direct payment to victims. At the end of the event, I've heard about experts in monitoring research being needed, as well as budgets that are allocated despite deadlines and government changes in Kosovo, that the financing is very critical to have sustainable funds. I'm aware that a report is going to come out soon. We talked about, I heard you talk about, I just drew, patient rights and the expenses in addition to births, interruption of services for the chronically ill and vulnerable groups. But many of the answers were positive, that there were 20 centers for women established where there were nurses and doctors and restored services via mobile phone. Important to continue the vaccine. International partners will be helping. There was counseling provided for women in terms of psychological and violence counseling. It was fascinating to hear this gentleman, whose name I apologize, I don't remember, speak about the work that he does with boys in terms of prevention, to make sure that gender stereotypes are also eradicated when it comes to, children's books and early education and kindergarten, that the messaging isn't there yet to teach the young boys and girls of how to improve the society and the relationships. Balkan violence, alcohol problems, awareness that boys are also victims. What else might you want to see? A person who's upside down holding the world. It's crucial for women to be deeply involved. Ms. Ulrika Richardson from the UNDC thinks of this experience as an opportunity. I think everyone does. We have a moral obligation. Mr. Tanin considered there was so many setbacks, but there are opportunities right now to reflect a little mirror and move forward in a positive way. It was a pleasure to participate.
Thank you so much, Tracy. For me, this illustration is so very innovative. Thank you for this reflection. Thanks again to our honorable guests and to the audience. And before the closing of the event, I would like to hand over to our dear friend, Deputy SRSG Barry Freeman, for the closing remarks. Barry, the floor is yours.
I'm really honored to close this event. It's been a great one. I'd like to first thank SRSG Tannen, Development Coordinator Ulrika, Flora from UN Women, our UNMIC Gender Advisor Javiera, and all the panelists for their rich presentations, and to the participants for their excellent questions and comments, and Tracy for the amazing drawing, which captured the event so well. We've heard eloquently from everyone today, not only on the hard challenges and how you've met them, but you've also offered practical solutions and pathways for the future. There will be an outcome document capturing the day's proceedings as well as a short video, and we hope that this conversation today will spark greater engagement and, of course, action. Let me repeat, and as noted by SRSG Tannen in his opening remarks today, COVID-19 is a crisis with a woman's face. Women have been the most severely impacted by the pandemic, including in terms of livelihoods and security. We've seen an alarming increase in domestic violence during COVID-19 in Kosovo and around the world. Let's break this cycle against women and men, including through continued financial support to shelters, for counseling and economic empowerment initiatives to support survivors. We've heard today, and we know this, women are the bedrock of the health workforce and on the front lines. They are strategically placed to observe and track behavioral responses to the pandemic, incorporating their firsthand knowledge and experience at decision-making levels of response and recovery is absolutely indispensable to recovery efforts. Integrating the needs and priorities of women from all communities, majority and non-majority, will help drive a better recovery and will ensure that Kosovo emerges from this crisis more united as a society. Women from all strata of society, including the local level, and we heard that today, should be offered platforms to express their needs and priorities, to advance their participation in decision-making, and feed into policy responses. Women's organizations in Kosovo should play a key role in bringing together and aggregating the voices of women from diverse communities and backgrounds. Continued economic investment in livelihoods is imperative to ensure that women are not left behind in recovery efforts. To paraphrase to Ulrika today, women's meaningful participation in pandemic-related decision-making is the good thing, the just thing, and I would add, the smart thing to do. But we need men to step up as critical partners in advancing and supporting women's engagement in the COVID response. So let's seize the opportunities before us before we lose them. In closing today, we know that crises always present opportunities. Today's session is a call to everyone to work together towards effective responses and an inclusive recovery. This is our collective moral obligation, our charge for the future. Thank you all.